Hello everyone and welcome to Know Your Drug, powered by MediInsights. The ultimate destination for all things of health and wellness from the fascinating world of medicals and pharmaceuticals. We are here to guide you on pantoprazole injection, exploring the various aspects of pantoprazole, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of pantoprazole injection. Pantoprazole injection is primarily used for the short-term treatment of gastroesophageal reflux disease with erosive esophagitis, where oral administration is not possible. It is also utilized in managing pathological hypersecretory conditions like Zollinger-Ellison syndrome. By reducing gastric acid secretion, it helps heal erosive esophagitis and treat conditions associated with excessive stomach acid. Next, dosage of pantoprazole injection. The typical adult dosage for GERD with erosive esophagitis is 40 mg once daily through intravenous injection. For Zollinger-Ellison syndrome, the initial dosage is 80 mg intravenously every 12 hours, which can be adjusted based on patient response and acid output. Treatment duration for GERD usually spans 7 to 10 days, while for hypersecretory conditions, it continues as clinically necessary. Dosage adjustments for patients with hepatic impairment are not required, but monitoring is advised. Specific dosages may vary depending on individual patient needs and should be determined by a doctor. Next, mechanism of action of pantoprazole injection. Pantoprazole is a proton pump inhibitor that suppresses gastric acid secretion by irreversibly binding to the H+K+ ADPase enzyme system at the surface of the gastric parietal cell. This action blocks the final step of acid production, leading to reduced gastric acidity. Next, side effects of pantoprazole injection. Common side effects include headache, diarrhea, nausea, abdominal pain, and injection site reactions. Serious, though rare, adverse effects may include Clostridium difficile-associated diarrhea, osteoporosis-related fractures, vitamin B12 deficiency, hypomagnesemia, and acute interstitial nephritis. Next, important advice for using pantoprazole injection. Pantoprazole injection should be administered under the supervision of a healthcare professional. Monitor for potential side effects, especially in long-term use. Inform the healthcare provider about any other medications being taken to avoid drug interactions. Pregnant or breastfeeding women should use pantoprazole only if clearly needed and prescribed by a physician. Patients should be advised to report any severe side effects, such as persistent diarrhea, muscle spasms, or signs of low magnesium. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for using pantoprazole injection. Remember, knowledge is power, and being well informed empowers you to make the best decisions for your health.